name is Brian. I'm an N3 student, and today I'm going to be performing a central line dressing change. For this dressing change, my patient is going to be Jerry Brown. He was born on 11/11/11. He has no allergies, and this is his dressing. Transparent dressing. Here's his central line. For this skill, I want to bring up my sterile field. Before I place my equipment, I gotta disinfect it with the proper disinfectant and let it, wipe it down for 30 seconds. Let it air dry around 1 to 2 minutes, depending on the antiseptic. And I also want to say it's not at my waist level. Typically they're going to be on my waist level or above, and I'm going to pretend it is. That way I don't break sterile field. And I gotta give my patient a facial mask and wear the right appropriate PPE, which I have right here. I'm now going to go ahead and begin the skill. Hello, my name is Brian. I'm going to be your nurse for today, and today I'm just going to be performing a central dressing change, provide privacy and hygiene. Okay, so for this dressing change, again, before I explain it to you, can I go ahead and just see your armband, verify your name, date of birth with 2 identifiers, see if they're correct. They are. His name is Jerry Brown. Birthday tells me it's correct. Okay, Mr. Brown, do you have any allergies? He has no allergies? All right. So again, I'm going to be performing a central dressing change. This dressing change is due to a doctor's order or because it's visibly soiled or loose, or we change it according to facility's policy. I'm just going to replace a new dressing on you. I'm going to prevent, that new dressing is going to help prevent any infections. And it's going to help us assess your suture site more easily. Do you have any questions? No questions? Okay. So again, for this procedure, I'm going to give you a facial mask, and I just want you to point away from your suture site while I change it throughout the procedure, and you can look back when I tell you the procedure is finished. Okay, so I'm going to hand hygiene one more time. Put on my facial mask. Hand hygiene and give my patient their own facial mask. Here you go. Go ahead and wear that, Mr. Jones. Point that way, away from the site. Now I'm going to go ahead and put on my own gown. Okay, now I'm going to bring my equipment over, disinfect it, 30 seconds to 45 seconds depending on the disinfectant. Make sure it's above my waist level, and I want to set my equipment there and perform hand hygiene, let it air dry before I put anything there. Put on some gloves. They're just regular gloves. And I'm just going to be removing his dressing, and at the same time I'm going to be inspecting his dressing and putting this alcohol prep swab so it can be easier to come off. I'm going to be, this is my trash. I'm going to be inspecting for infiltration, inflammation, and infection. Infection is like a rise in temperature. I'm also going to raise my patient at my at my waist. I'm going to commit one hand. Again, make sure the dressing, I stabilize the catheter. And again, I'm going to be inspecting for infiltration, which is like leakage, pain at the site, inflammation, which is redness, or infection, which is a rise in temperature. I'm also going to be checking for any cracking, crepitus, which indicates there's air in the line, or there's air in the line. Peel towards the catheter, stabilizing it, make sure the bio patch is correct and everything. Pull it towards it, inwards towards, so I won't yank on the central line. Take it off. and dispose it in the proper waste, biohazard, because there we go. And now I'm going to be inspecting the length from the suture site, like how long the suture, any loose sutures, how long the length catheter is exposing. Usually it's marked. Once I have that information on, I'm going to go ahead and start my sterile procedure. Remove my gloves. Hand hygiene. Let's go ahead. Open this up. Hand hygiene once more. Move it around. There we go. There we go. Okay, since it's sterile to sterile, I'm going to just move these across. Open up my bio patch. Dump it in there. This is trash. Grab my chlorhexidine. My dressing. Since everything's sterile, I don't have to worry about, crossover, because it's sterile. And I have all the equipment necessary. I'm going to commit one hand to stabilize the central calf, and that would be my dominant hand. I'm going to go ahead and crack this open. Crack. There we go. And scrub back and forth. A relatively strong or generous motion for 30 seconds. Once 30 seconds passes, I'm just going to use, the leftover residue to clean around the site. There we go. This goes in the waste. I'm going to grab my bio patch again. Commit my hand once more. And I want to make sure the green is pointing upwards and the central line rests on the slit. There we go. Okay, as you can see, it moved. At this point, it wouldn't move in real life because the table is slippery and it's smooth, so it wouldn't happen in real life. In real life, I would actually have it. There we go. And then I would finish and remove my hand. Make sure, again, the bio patch is, the green's pointing up and it's resting in the slit. Grab my dressing. Peel it off. I'm not going to peel it off because I may need it again. Peel it all the way off. Attach it there. Hold my hand for like a good, 5 seconds. The warmth makes the stickiness, adhesive stick. And remove these flaps. And at this point, the sterile process is complete. I can go ahead and remove my sterile gloves by, pinching right here. Ball. And putting 2 fingers underneath. Biohazard, appropriate waste. Hand hygiene. Remove my gown. Then I would remove my mask. Before I remove my mask, I'm going to hand hygiene again because I don't want to touch my face. Remove my mask. Proper receptacle, biohazard. And then I would go ahead and, put on some gloves. Document this with my date, time, initial. Once I document this with my date, time, initial, I will go ahead and set it for the dressing. Take off the gloves, hand hygiene, tell my patient, okay, Mr. Brown, how did that feel? Listen to his tolerance about the procedure. I can tell him to take off his mask. I'm going to go ahead and document what I saw, if I saw any infection, inflammation, infiltration, how long did the the central line was coming out of the suture site, record the length, record if there was any loose sutures, record the dressing I performed, and record my name, date, and initial. Give him, put him back, lower his bed, give him side rails up, safety bell, and procedure will be done. Thank you.